Honored members, let us pray. Almighty God, we beseech you to behold with your abundant favor and blessings as your servants, whom you have been pleased to call to leadership positions in this republic. We seek guidance to treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to advance the peace, prosperity, and welfare of our country, and of those whose interests you have committed to our church. Amen. Good afternoon, honorable members. Welcome to our afternoon session. Tuesday, 26th September 2023. Supposed to start at 2:30 p.m., but we had a board meeting, and that is the reason for the delay. Honorable members, we can proceed. And clerk.
Order number 1, administration of oath.
Next.
Order number 2, communication from the chair.
Yes, honorable members, I have a communication to make. This is in regards to our visitors at the public gallery. And I would like to acknowledge the presence in the public gallery this afternoon of visiting students and teachers from, these are pupils and teachers from Riverside School, that the award is in Kipchebor. And we also have St. Patrick's. These are also visiting pupils and teachers from St. Patrick's Primary School from Kapkugerwit. And of course, in our usual tradition of receiving and welcoming visitors to this assembly, I extend a warm welcome to them, and on behalf of the assembly, wish them a fruitful visit. So our visitors at the public gallery, you are welcome to follow the proceedings live this afternoon. Of course, after this session, Sergeant Adams will guide you on the next step after we are through with the session. Clerk.
Order number 3, messages.
Next.
Order number 4, petitions.
Next.
Order number 5, papers.
Next.
Order number 6, notices of motion.
Next.
Order number 7, statements.
Honorable members, we have, as directed this morning, we have progress reports on statements committed to the Committee on Land, Housing, Fiscal Planning and Settlement. And the chairperson, the Honorable Hezron Ngetich, please proceed with your status reports. This progress report.
Thank you, Honorable Speaker, sir, for the opportunity you have granted me, Mr. Speaker, so that I can give status or progressive report on various statements raised to my Committee on Lands, Housing and Fiscal Planning. Before, Mr. Speaker, allow me to join you in welcoming the student, pupils, teachers of Riverside, learners of Riverside School and St. Patrick to this honorable house, and to tell them they are most welcome to this honorable house, whereby we transact businesses related to the 4 county government units. And this is a house, honorable house, which is a replica of the National Assembly and the Senate. So find yourself comfortable, whereby you will draw your inspiration, and maybe in future you will be great leaders. Otherwise, have a fruitful stay and learning process in this house. Mr. Speaker, as about our standing orders, Mr. Speaker, number 205, Mr. Speaker, on the on the function of several various committees, Mr. Speaker, allow me to read Standing Order number 205, subsection 5, which stipulates and states the functions of sectoral committees, Mr. Speaker. One of the functions, Mr. Speaker, of sectoral committees is to investigate, inquire into, and report on all matters relating to the mandate, management activities, administration, operation, estimates assigned to the department. B, study the program and policy objective of the department and the effectiveness of implementation. C, study and review all county legislation referred to it. D, study, assess, analyze relative success of the department as measured by results obtained as compared with their stated objective. E, which is very important, investigate and inquire into all matters relating to the assigned department as may be deemed necessary and may be referred to them by the Assembly. Mr. Speaker, as per that standing order, Mr. Speaker, we had honorable members, Honorable Matt Kay, Isaac, on 6th this month, Mr. Speaker, raised a statement on concerning the number of housing units that were formerly owned by DFAC local authority, which was raised on 6th September. The same time, Mr. Speaker, he raised a statement concerning the number of employees serving both Kericho and Litein municipal boards. On 27, Mr. Speaker, Honorable Philip Mutai, on 13th, Honorable Philip Mutai raised a statement to same committee concerning the number of plots owned by cooperative societies in Kericho County, location of the said plots, and whether the plots are available for use by the cooperative societies. And then on the same day, Honorable Matthew Korir raised a statement concerning Kasim Tahani project, number of people recruited for Kasim Tahani. And on 20th, Honorable Cheriat Bed on 20th September raised a statement concerning Kericho Modern Market, Mr. Speaker. Mr. Speaker, the reason why I bring this progress report, Mr. Speaker, is because this report, Mr. Speaker, was due today, Mr. Speaker. And because you are directed, I report back some of the report, Mr. Speaker. And when we received when you committed to us, Mr. Speaker, we deliberated as committee. And after deliberation, Mr. Speaker, we write forwarding letter to the department for response, so that after giving us the response, we come deliberate, go to visits, and then come back, deliberate, and compile a report, and then report back to the floor of the House. But Mr. Speaker, the reason why I'm saying so is I am seeking extension of time, Mr. Speaker, is because after us writing to the executive, they have taken time to write back the response, Mr. Speaker. And up to date, Mr. Speaker, as you are seeing on the schedule, which I have tabled on your table, Mr. Speaker, is that the statement which was raised on 6th, it was supposed to be due on 20th. There is no response not yet received from the executive. Again, or which was raised on the same day, all we have not received, Mr. Speaker. Although there is two, which three which are still still has time, which should be responded tomorrow on 27 and one on 4th. But all of them we have written to the executive, but they have not written back for us to deliberate and then report back. So on that, Mr. Speaker, the committee observed that the two statements raised by Honorable Isaac McKay were due to be responded on 20 September 2023, but the department has not responded up to date. And number two, that the statement raised by Honorable Philip Mutai, Honorable Matthew Korir are due to be responded tomorrow, 27 September. And that the statement raised by Honorable Cheriat will be due on 4th. The committee recommends that recommend to request for additional time of 14 days to prepare and respond to the statement, Mr. Speaker, because there has been a delay. And because this committee is a committee which we committed to respond our statement on time as the way you have directed. We saw it fit, we do a progressive report so that we inform the House on where we have reached and seek for extension of additional 14 days so that we get sufficient time to respond back. Thank you, Honorable Speaker.
Okay, thank you very much, the Honorable Leslie Kentich. Just a clarification from your statements committed to the committee. There is statement raised by two statements raised by Honorable Isaac Metker. That is the one on 6th September 2023. We have one by Honorable Philip Mutai on 13th September, and also the one for Honorable Matthew on 13th September. And then there is the one by Honorable Cheriot Bate on 20th September. And I can see that none of them has been responded to. This statement was committed to Committee on Land, Housing, Fiscal Planning and Settlement, is it? And therefore, the response ought to have been from the Department of Lands, led by the CC in charge of lands, housing and planning. And clerk, can you confirm that the letters was dispatched to these to the department as confirmed by the chair? You can confirm that. So you can confirm that it was dispatched. Of course, honorable members, you from the progress report by the Committee on Lands, Housing, Fiscal Planning, that is by the chairperson, the Honorable Ezron. It is clear that the Department of Lands has even failed to respond to these statements raised by honorable members, which in fact is not a good thing, because it is the role of this county assembly, these two committees, to play their role of oversight and representation. I'm actually perturbed that there is no response, including even seeking for extension of time from the executive, and that is from the CC lands. And I therefore direct that CC in charge of lands, physical planning and housing be summoned through an invitation to appear before the Committee on Lands within 7 days from today, and therefore an invitation immediately after this sitting should be forwarded to the CC for lands, housing and physical planning. It is important that the executive take the county assembly on very seriously, because these are issues raised concerns the residents of this county. So the Honorable Chair be advised and clerk note that accordingly and act accordingly, and we expect, as you have requested the chairperson, we are giving you, we grant your request of 14 days, and that will be 14 days to prepare and respond to those statements. That means I will give you 14 days from the date when the CC will appear, and the CC will appear in the next 7 days. So clerk, note those timelines and give the correct dates for purposes of planning for order of business of this house. Okay, thank you. The next is on, there was a statement raised by the Honorable Peter Kemoy, that is the MCA for Kapsuser, and this was to Committee on Health Services. And the response is ready. The Honorable Chairperson for Health Services, Honorable Eric B., proceed with the response.
Thank you, Honorable Speaker, for giving me an opportunity this afternoon, just to table the report raised by Honorable Peter K. Moy. First of all, allow me to welcome people from Riverside Academy to this session afternoon, Mr. Speaker, and tell them that this is House of Rules and Procedures, and I wish them a fruitful visit this afternoon. Mr. Speaker's passion to standing order number 205, whereby it states the functions of sectoral committees. It has been read by a colleague, Honorable Elstrom, and it states all those roles of sectoral committee. Mr. Speaker, let me go straight to page number 6, whereby it's allow me to read through the committal.
Proceed from 2.1.
2.1. The committal to the Committee on Health Services. Mr. Speaker, the statement was committed to the Committee on the Health Service on 28 September 2023 for inquiry and reporting to the Honorable House for consideration. The Committee on Health Service in its sittings resolved to request the Office of the Clerk to write to the County Executive Member in charge of health services for the responses concerning issues raised on the statement. The CEC in charge of health services responded to the statement via the letter dated 22nd May 2023 as the annex copy shows. Number 2, Mr. Speaker, history on Linda Mama program. All these questions, Mr. Speaker, was asking about Linda Mama, and allow me first of all to bring to the attentions the meaning of Linda Mama program. Linda Mama, Mr. Speaker, is a health service, is a healthcare package that targets the expectant mothers who are unable to pay for the healthcare. Mr. Speaker, it covers the antenatal clinics, which are 4 clinics, and also, Mr. Speaker, the normal deliveries and the cesarean section down to the mother during delivery. And also, Mr. Speaker, it covers 3 months post-delivery and only 3 months post-delivery service for both the mother and the child. Linda Mama program is a free health insurance plan exclusively for mothers and their newborn that eliminate financial barriers to accessing the maternal care services. National government-sponsored initiative that was introduced in 2013 as a financing strategy to provide affordable care, and it was launched by NHIF in 2016. Mr. Speaker, Linda Mama covers for the period of pregnancy, that is antenatal in other terms, and postnatal. It covers the pregnancy and delivery and the child postnatal until immunization is complete. Mr. Speaker, Linda Mama covers can be accessed in all public hospitals and some charity and faith-based organization. Number 3, Mr. Speaker, the statement sought to address the following issues which were raised by Honorable Member, that who is eligible to access Linda Mama initiative. Mr. Speaker, the Linda Mama program is open to all pregnant women and postnatal mothers with a national identification card, and for underage or those without ID, they will use their birth certificate. Number 2, Mr. Speaker, Honorable Member was asking the criteria used to enroll beneficiaries and what point can they access the maternal services. All pregnant women, Mr. Speaker, and postnatal mothers are to be enrolled. Schemes covers, as I said, that 4 antenatal visits, that is clinics where the mothers attend to the hospital, and it also covers normal deliveries, whereby a mother delivers, and cesarean section, where they undergo for theater surgery and what have you, postnatal visit and complication arising from pregnancy-related issues for both the newborn. They will assess the services when presenting to the any contracted facility. Number 4, Mr. Speaker, can Linda Mama program cover both the mother and the newborn child? For instance, those children care at the nursery or incubators. The program, Mr. Speaker, covers both the newborn and the mother. These include nursery admission. They cover 3 months after delivery. I think, Mr. Speaker, it is a self-explanatory answers. These are mother's experience during and after delivery. Number 4, Mr. Speaker, for with twins, those who are lucky to have twins or triplets, are both covered by the Linda Mama initiative schemes. That is a question which you ask, Mr. Speaker, and the response, and as per the NHIF regulation, the schemes cover only one admission. When I talk of one admission at a time, Mr. Speaker, is when one child is admitted, it covers only one. So there are so many cases, and whereby we also ask when we visit the facility, why should they cover one? They give us, those are the regulation, and we never, we didn't do anything as per the regulation. That was as per the NHIF regulation. Number 4, Mr. Speaker. Number 5, which facilities in Kericho operate Linda Mama initiative schemes? Mr. Speaker, the response are all county government of Kericho facilities over the programs once they have signed a contract with NHIF, also in private and in faith-based organization facilities who have signed the contract with NHIF. Mr. Speaker, lastly, what contribution can the county make to supplement the Linda Mama program initiative? 1, the Department of Health Services will appreciate the support of the county assembly in mobilizing the citizen in enrolling into the NHIF schemes. That is national scheme, Linda Mama schemes, Edu Afia schemes. There is need for resource mobilization to enable the citizen to all NHIF scheme. The facilities need laptops and computers for enrollment, especially in level 2 and in level 3 facilities, Mr. Speaker. That is, when you go to our dispensaries and health centers, they don't have these computers for enrollment. So as a county government, they need for them to facilitate with all laptops and computers. Expansion of services for ANC test and maternity services. Now, Mr. Speaker, objective of the Linda Mama program, to achieve universal cases for maternal and child health services and contribute the county programs progress towards universal health coverage. All contracted NHIF health care providers for public and the private, and also for the faith-based organization, assess the service derived and covered by the program. It contributes also to the boost of antenatal care. We got some challenges, Mr. Speaker, whereby the Linda Mama are facing. 1, there was inadequate sensitization, which most of the people and the communities are not aware about Linda Mama. Number 2, Mr. Speaker, lack of information among the mothers on availability of Linda Mama programs. And number 3 is, unlike the previous free maternal policy, mothers are to register to access Linda Mama services. Number 4, there is inadequate fund to support Linda Mama program. I move to recommendation, Mr. Speaker. The Committee on Health Services made the following recommendation. based on the Linda Mama program. Number one, that county executive committee in charge of health services should liaise with the relevant authorities for sensitization across the county. Number two is that the Department of Health Services should improve on level 1 and level 2 hospitals, that is dispensary and health centers, to accommodate for the delivery services on the patient with using Linda Mama. The last one is the Department of Health Service should equip, that is level 1 and level 2 facilities, with the said laptops and computers for easier enrollment of the patients or the clients. And lastly, Mr. Speaker, allow me to thank, first of all, your office for taking for giving us an opportunity for valuable input and contribution in consideration of the response to the statement raised by Honorable Peter Kemoi. I sincerely thank your office and the clerk for the great support they accorded us. Otherwise, I table this report. Thank you, Mr. Speaker.
Thank you, the Honorable Eric B. as the chairperson for Health Services, Committee on Health Services. I'm informed that we have other visitors who will be joining us. But before then, I want to give this opportunity to the Deputy Speaker, Honorable Eric Bett, so that you can contribute on this matter, as well as take an opportunity to extend invitation to the pupils and teachers from Riverside, Kipchaba Ward.
Thank you so much, Honorable Speaker, for giving me this chance to rise also, to give my contribution on the report raised by the Chairman for Health. And before that, I would like to take this chance to welcome the learners from Riverside School here in Nyagacho. It is in my ward. Mr. Speaker, sir, last week when I was doing my development projects in the area, these learners were able to invite me to their school and challenged me that they're learning about government in Kenya, and evolution was one area they were trying to understand. And I went to class and I was given a whiteboard and a marker to teach them about evolution in respect to County Assembly of Kericho. And I also told them that for them to learn the practical part, they should make a visit to the County Assembly of Kericho to come and learn what I told them. Mr. Speaker, sir, they are looking forward to even after this session to feel how that seat of the Speaker feels, if it is hot or cold. So, Mr. Speaker, sir, I want to tell the learners that after today's visit here in the Assembly, you'll be able to conceptualize what you'll be learning in school and what I taught you last week when I came to your school. So very much welcome, and learn as much as you can, because the leaders of tomorrow will occupy these same seats we are sitting in today. And so work hard in school, and all the best. Mr. Speaker, sir, I want to, the issue report by Health Services Committee is a very important statement raised by Honorable Peter Kemoi on the issue of Linda Mama program, which is a critical program, and for it to have been raised by Honorable Member, it is a critical question to be asked. And I want to thank the Committee on Health, led by able Chairman Eric B, for being able to answer this particular question raised, and also to ask the committee, since they have said one of the challenges was the not adequate sensitization, would also like to ask the committee also to proactively also see a way of ensuring that the sensitization is not only done by the executive, but also as the members of the county assembly, and including also the members of the committee, so that this program can be well adopted in the villages, and it can help our people, especially our mothers, who really need this kind of program, which its objectives were meant to help our mothers who are giving birth to children and also bring up the young ones. So I wish to also ask the committee that one of the challenges you've said is inadequate funds. And so you need to also fund a way of pushing programs which will come to the committee on budget to ensure that funding is availed, to ensure these programs are also funded from the county kitty and even beyond. Otherwise, I do support this report, and congratulate the Committee on Health for doing a good job. Keep doing well. And as the Chairman Larson, I say keep it up, Health Committee. This is a well done report, and we wish you the very best as you move forward. Mr. Speaker, thank you for giving me the honor to speak. Thank you.
All right, thank you, the Honorable Deputy Speaker. And on that note, Sergeant Atam, because I'm told there's another group outside, as we continue with the order of business, you can plan yourself accordingly at the public gallery. Honorable members, want to give one or two honorable members to contribute on this report so that we can proceed to another agenda. Yes, the Honorable Ezra Onyatich.
Thank you, Honorable Speaker, for another opportunity you have given me, Mr. Speaker, to make some comment, Mr. Speaker, relating to the statement response by Committee on Health, Mr. Speaker. Mr. Speaker, allow me to thank the Chairman Health Committee, Mr. Speaker, and the entire committee, Mr. Speaker, for a comprehensive response to the statement which was sought by Honorable Peter Kemo, Mr. Speaker, on the issue to do with Linda Mama, Mr. Speaker. I want to thank the committee, Mr. Speaker, because they gave us an elaborate response, Mr. Speaker, on various issues which was raised by Honorable Member, Mr. Speaker. Linda Mama program, Mr. Speaker, is a program which was timely, Mr. Speaker. And when you do analysis and look at the statistics, Mr. Speaker, since the Linda Mama was inceptionalized up to then, Mr. Speaker, you will see and find that, Mr. Speaker, there is more successes towards this program, Mr. Speaker. Because initially, Mr. Speaker, there used to be a lot of issues to do with deaths and deaths which during the period, Mr. Speaker, whereby you used to lose either a mother or a minor, or both a man or a minor during the deliveries, Mr. Speaker, because it used to be expensive for mothers to go to clinic, Mr. Speaker. But now during when the Linda Mama program was inceptionalized, and we have been told, and it is self-explanatory, on the stages on which Linda Mama program covers from pregnancy period. Once the mother is pregnant, is expectant, it goes to the clinic and she is registered and she starts benefiting from the program, whereby the insurance cover, the Linda Mama will take care of the entire process from the pregnancy and during delivery and after delivery, Mr. Speaker. And to make even more interesting, Mr. Speaker, some of the mothers benefit during delivery. They are being given some mosquito nets, a packet of some goodies, Mr. Speaker. And I know, Mr. Speaker, you are one of the beneficiaries, because recently although you didn't went to paternity leave, which we must force you to go to paternity leave because you're still under paternity leave, Mr. Speaker. But I know the mother at home, the mom, has benefited from the Linda Mama program. So this Linda Mama program has brought more goods than and eliminated more harms. One concern, Mr. Speaker, which I've seen and which we need to see on how to handle the policy part of it, Mr. Speaker, is the issue on whether the scheme covers how many admissions. The policy stipulates clearly only that the Linda Mama covers only one admission. And it disadvantages people from my area, Mr. Speaker, whom we are sharpshooters. We shoot and we get 3 children as a pair, Mr. Speaker. So it disadvantages most of the
Honorable Honorable Ezra, please take your seat. There is a point of order. Before then, before the Honorable Gilbert Ngatich comes in, now that there is a small interruption, we are also privileged, and I would like to acknowledge the presence in the public gallery this afternoon of visiting pupils and teachers from St. Patrick Primary School, Kapkugerwet Ward. Of course, in our usual tradition of receiving and welcoming visitors to this assembly, I extend a warm welcome to them on behalf of the assembly, wish them a fruitful visit. So our visitors from St. Patrick Primary School, Kapkugerwet Ward, you are welcome to follow us, our live proceedings as we continue with the order of business of this afternoon. This is Kericho County Assembly, and you are privileged to witness firsthand events, what is happening at the chambers. The Honorable Gilbert Ngatich, you are on a point of order.
Okay, thank you, Mr. Speaker, sir, for giving me this opportunity. Also to applaud the Committee on Health on the work done well, but on the point of order from the Understanding Order 101, the Honorable Member, I don't think is actually doing the justice to the visitors who is at the gallery, to use a very a language which is much vulgar, that they are shooting to kill, and those are not entailing in this report, Mr. Speaker, sir. In this school which is here, we have children. We have also brothers and sisters there. We have our children there, Mr. Speaker, sir. And because this is a parliamentary session in which there is some rules and order, the other language should also be suspended, so that we make them learn as we prepare ourselves the day in which we can use any language in this house. Thank you, Mr. Speaker.
Honorable Ezra Ngatich, of course, you have heard what the Honorable Gilbert Ngatich has raised. It is whether the term that you have used, whether it is a parliamentary language or not. And I didn't get you properly. Perhaps you can step to the floor and make a clarification. If it is not a parliamentary language, then I'm sorry, you've got to withdraw that and proceed with your submissions.
Thank you, Honorable Speaker. According to Standing Order 101, subsection 2, Mr. Speaker, if a member has a sufficient reason to convince the Speaker that the member is unable to substantiate the allegation, Mr. Speaker, I can substantiate, Mr. Speaker, and I wanted to elaborate, Mr. Speaker, on the point whereby I was referring where the Linda Mama policy only covers one admission. And I wanted to substantiate this way, Mr. Speaker. I was saying this part of the policy, Mr. Speaker, is disadvantageous because some other areas, warm areas like where I'm coming from, Mr. Speaker, where reproduction is so high, Mr. Speaker, because we have a lot of food, we have good weather, we have good climate, and it's favorable for reproduction. So, and we have had, and it has been in public domain, it has been in news, that Chilchila is leading in a set of pairs of twins, triplets, Mr. Speaker. So I was saying it is disadvantaging the people from my area, whereby it's normal to have twins or triplets, Mr. Speaker. So I wanted to substantiate that the NHIF, the Linda Mama scheme with this policy is really need to be relooked at, and I think I'm not out of order when saying so, Mr. Speaker.
Okay, the Honorable Ezra, if I got you right, you have substantiated, but I don't know whether you used an parliamentary word before. Is that the case?
If there was, Mr. Speaker, which I don't remember, but if there was, I withdraw.
Okay, proceed with your proceedings.
Mr. Speaker, as I'm ending, Mr. Speaker, I was saying I wanted to continue to applaud Mr. Speaker, the response by the members, Mr. Speaker, and I was highlighting on various positive impacts which have been touched by this program, Mr. Speaker. And the advantage of this program, Mr. Speaker, is covering all government health facilities. And up to the rural areas, Mr. Speaker, the local dispensaries, Mr. Speaker, which are connected with electricity and as a printer and a computer, they have managed to register and roll out the program. So we encourage the honorable members. We see how we can get financial to other level 2s and level 3 so that they can be able to roll out this program. And with the introduction of universal health coverage, Mr. Speaker, which the President will be launching, I think it will be a plus, Mr. Speaker, and I think the health issue will be promoted in our county and in our nation, Mr. Speaker, and it will be progressive because, as the saying goes by, a healthy nation is a progressive nation. Once we have addressed the issue of health issue, Mr. Speaker, I think we will be progressive, Mr. Speaker. After addressing the health issue, Mr. Speaker, and addressing the issue of food security, which the Kenya Kwanza government is committed on it, Mr. Speaker, by introduction of cheap fertilizer subsidy, whereby we have seen the impact of a lot of influx of food production. So we have addressed again the issue of food security. So going into the future, Mr. Speaker, I think everything will be in order, and even the vulnerable families, they will not have any cause of worry, because when you go to hospital, you have universal health coverage, which you have a universal insurance which covers on health during even expectancy, during any challenge to do with health. And then again, you have food, and again, we have introduced the issue of good funding towards education. So I think as a country, Mr. Speaker, we are moving to a level whereby we are elevating, we are now becoming a developing country, not a third world country, because if the health is well taken care of, the issue of food security, the issue of education, I think we will be moving on the right direction, and we want to applaud the Kenya government and the Kenya Kwanza government for the good initiative. Thank you, Mr. Speaker, and I thank you for the opportunity of granted.
Thank you so much. Before I give to Honorable Paul Chiti, the Honorable Ezra Ngatich, you alluded that, of course, I am a direct beneficiary of Linda Mama. However, whereas I applaud, of course, the Linda Mama initiative, I don't think for fathers, we were not given any goodies, just for purposes of clarification, because maybe you mentioned something like a package of goodies. So just to confirm to this house that not even a sweet also were given to me as a beneficiary. Okay, the Honorable Paul Chichi.
Thank you very much, Mr. Speaker, sir, for giving me a chance to make my input on the report on statement raised by Honorable Peter Kimoi. Mr. Speaker, sir, this report coincides with yesterday's launch by the President of Universal Health Providers Kits, which were rolled out in the entire country, Mr. Speaker, sir. But before that, allow me to use this opportunity to welcome pupils from St. Patrick's Primary School. Feel welcome. The County Assembly here is a replica of the National Assembly, and we are a legislative arm of the county government. What happens here is the same thing that happens in the National Assembly. So you're free to learn, you're free to get to know how business is done here. Mr. Speaker, sir, Linda Linda Mama program. It's a free health insurance plan which, as per the 8 Millennium Development Goals, Mr. Speaker, two of the Millennium Development Goals, Mr. Speaker, sir, is one is on reduction of child mortality, two, to improve on maternal health. So with this Linda Mama, Mr. Speaker, sir, it has helped to reduce child mortality, Mr. Speaker, sir. Two, it has also helped on maternal health, Mr. Speaker, sir. The only problem, which I think the chairman needs to clarify, is that Linda Mama covers the mother and the child. But in case a child is born before 9 months and is taken to the nursery, there are charges that Linda Mama does not cover. So all this, Mr. Speaker, sir, is in terms of information. So the public should be sensitized on the areas that Linda Mama covers, because sometimes you find mothers, when they go to deliver, they are told whether they have registered Linda Mama. That's when they get to ask whether they can register at that time. So a lot of information is needed, but this Linda Mama, Mr. Speaker, does an excellent job. So I support the report, and I laud the Committee on Health for doing an excellent job. And I pray and hope that as Kenya Kwanza, in our manifesto, universal health care was top the list of our agenda, Mr. Speaker, sir. So this Linda Mama plays a critical and key role in provision of universal health care, which was part of our agenda as Kenya Kwanza government. So the Committee on Health, that was a job well done. Thank you very much, Mr. Speaker, sir.
Thank you so much. Of course, honorable members, as you are aware that the standing orders limits us to 15 minutes discussion on this statement. But of course, I know we have honorable members of County Assembly who are women, who are beneficiaries of this Linda Mama program, or who are aspiring to be beneficiaries of this Linda Mama program. I will use discretion of standing order number 1 to give to the honorable members of County Assembly of who are here, and I have seen the hand of the honorable Fancy, and Anita is a bit agitated. I don't know. I guess she is a beneficiary as confirmed, and therefore I'll give them an opportunity each a minute. I can also show the hand of the honorable Monica, so that you can contribute to this important subject. Honorable Fancy.
Okay, thank you, Mr. Speaker, for giving me this chance. And I would like to take this opportunity to welcome our pupils from St. Patrick's. Welcome to this house, and you will learn a lot from us. Mr. Speaker, sir, I'm not one of the beneficiaries, and I'm not planning to be one. But I want to report that for sure the Linda Mama has really helped a lot of many of our mothers, and I've witnessed several times. And one of the problems, I think, which Honorable Peter Kemoy picked, is that when you get a mother who has twins or triplets, they are being told that we are only given one chance. It's not both the children, as the chair had given us the report that they are helping both children. It's only one. That is from now the hospital. That is what we've seen and we've witnessed several times. Mr. Speaker, sir, and we've been given all the challenges facing by the Linda Mama. For sure, you get mothers from the villages, and they are not even aware that there is something called Linda Mama. So we got to do something so that these mothers will get information that there is Linda Mama, and they got to register, because for sure they don't know about this Linda Mama. They are coming for clinics, and if you pass by in district hospital and ask a mother, they will ask you, iyo Linda Mama hiko wapi? So let's do something like sensitization, so that all the mothers will know that the Linda Mama is there and it's helping. And again, you had said in nursery, it covers up to the nursery level. A child which has been born maybe before the months. And the case is, it's not the case. We've got many mothers who are complaining that the Linda Mama is not covering the nursery. So, Chair, you got to give us the full report that for sure they are covering maybe from today, because for sure it's not covering. Otherwise, thank you so much. And there is something again which are picked from the hospital, the sign language in the hospital. You get a mother who is able differently, and you cannot give an information, and in the hospital you know what happens. So we need to help these mothers and all the patients in hospital, that that we should be having somebody who does the sign languages, a doctor who has the sign language thing, so that it will help all the patients, including the mothers. And again, that one reminds me of our flow, Mr. Speaker, that for sure we've got a concern that a sign language person here again is missing, and there's a complaint from the public that we should be doing that. Otherwise, thank you so much.
Thank you so much, the Honorable Fancy. The Honorable Monica, I saw that your hand was up, and confirmed to this Honorable House whether you are a beneficiary of Linda Mama program.
Okay, thank you so much, Honorable Speaker, for giving me a chance to give an input on this issue of Linda Mama. Before then, I would like to extend a word of welcome to our learners over there. You are welcome to this Honorable House. Pertaining the Linda Mama program, which has been going on, I want to say we are very grateful as a mother, and representing the many mothers out there. We want to say that we are grateful for what has happened in our health department. And like before, those days, mortality rates have really reduced. And we want to appreciate the government for such initiative. And what I would like to urge the health services is that they keep on sensitizing, especially in the rural areas, so that our mothers can benefit more on the same. And also widen the coverage, since we are being told that when one gets twins, one will benefit. And no mother will plan say that she will get twins or a single child. It is my plea that they widen the coverage. Otherwise, Honorable Speaker, we are grateful for the health department and also the Committee on Health who have given us this report on Linda Mama program. Thank you so much.
All right, thank you so much, Honorable Monica. I think we will have to leave it there. Perhaps if there were more time, we will have given out to the aspiring mothers in this house so that they can make their contribution. However, clerk, let us move to the next. Before then, I want to give, let me give on this report I would like to direct the Committee on Implementation to pick up this matter, especially on the matters of recommendation, as it will enhance the state of preparedness of our county towards the Mashujaa Day. Remember that His Excellency the President, William Samuel Ruto, will be launching universal healthcare here in Kericho, and this is a very important bit of the coverage that the President and Kenya Kwanza Manifesto is anchored on. So the Honorable Chairperson, implementation, you pick up that matter so that you can share it with the Department of Health Services. Clerk, next order.
Order number 8, motion by Honorable Eric B.
The Honorable Eric B, please move your motion.
Thank you once again, Honorable Speaker, for giving me an opportunity just to move the motion. Aware that the Kenya Meteorological Department has issued a warning about the likelihood of El Nino, a rainfall outbreak in the country between the month of October and December 2023. Further aware that the Kenya Meteorological Department on 30th July did an analysis on the likely impact on the El Nino, which include flooding, flood diseases such as malaria, chikungu, and dengue fever. Aware that Kericho is the backbone of economic activity, being agriculture is likely to be affected, leading to the destruction of crops and livestock. However, that, Mr. Speaker, Kericho has an history of a flash flood, and El Nino can worsen the situation, which will lead to the death and displacement of people and livestock. Further aware that disaster management is domiciled in the Department of Public Service Management. Now, Mr. Speaker, concerned that save for the Emergency Fund Act and its regulation, the county does not have any legislation or policy on this disaster management. Mr. Speaker, noting that in the county assembly, it is the county assembly role to oversight the executive and represent the people of Kericho County. Now, Mr. Speaker, I urge this honorable house to resolve the following. 1, the county executive formulate policies on disaster management within 3 weeks and submit the same to the county assembly for approval. Number 2, Mr. Speaker, the county executive formulate risk assessment framework relating to El Nino within 2 weeks and for the same to the county assembly. And number 3, Mr. Speaker, is that the county executive come up with the detailed possible disaster preparedness plan that the county has in mitigating the unforeseen impacts of the El Nino. Lastly, and the 4th, Mr. Speaker, is the county to initiate partnership with humanitarian organization, multinational corporate operating within and outside the county, and any citizen of goodwill who are willing to assist the county in mitigating the unforeseen impact on the El Nino in Kericho County. Mr. Speaker, we've had such cases before. The El Nino has really affected our area, especially we have regions like Kunyak, we have also areas like Chilchila, we have also areas like where I come from, Mr. Speaker. They have actually been affected by floods, landslide, and also a lot of rains, which of course the flooding. And we are aware that during, for the last 1 week, the county has actually announced the unforeseen outcome of El Nino. So for us as a county, Mr. Speaker, we have to be prepared so that in case we have such an outbreak, we may be able to mitigate. We should not caught with such incident when you are not prepared. So I request this honorable member, we debate and we approve this motion. Mr. Speaker, allow me to request Honorable Esron to second the motion. Thank you.
Honorable Esron Ngetich, second.
Thank you, Honorable Speaker, sir, for giving me this opportunity, Mr. Speaker, to second the motion by Honorable Eric B. Mr. Speaker, representing the people of Kapler-Artet. On this motion. On this motion, Mr. Speaker, we have seen and we have been warned by the meteorologists, Mr. Speaker, on the El Nino, which is coming, Mr. Speaker. And Mr. Speaker, this motion or these prayers by honorable members, Mr. Speaker, praying this house that we resolve the 4 prayers, Mr. Speaker, is timely. Mr. Speaker, some of the signs of outcome of El Nino has been felt in my place, Mr. Speaker. I was showing some honorable members. Right now, there is an outbreak of wild worms, Mr. Speaker, worms like insects, Mr. Speaker, a swarm of worms, Mr. Speaker, which is destroying every plant, any green matter, Mr. Speaker. Since this is the 2nd week, Mr. Speaker, it has destroyed the leaves within, it is eating even the tea leaves, and destroying the maize, Mr. Speaker. I had raised an alarm to the Department of Agriculture, Mr. Speaker, but they are taking a slow pace, Mr. Speaker, and those insects are like the locusts which we experienced, I think, some 1 year ago, Mr. Speaker. So it is a matter of concern, Mr. Speaker, and I think this motion is now timely so that we know from the department, Mr. Speaker, what are the possible preparedness, how prepared our departments and our county is in the likelihood of the outcomes of the El Nino. Remember, Mr. Speaker, and last time, Mr. Speaker, when you were CC in charge of finance, in charge of roads, Mr. Speaker, you know most of our areas is being affected most in case of flash floods and heavy rains, Mr. Speaker. It destroys a lot of roads. And we went together with you, Mr. Speaker, when there was a heavy flash floods which affected an area called Kapkese. And it displaced hundreds of houses, Mr. Speaker, because those areas are steepy and slopy. And honorable members here can bear us witness that during the incidents which happened, emergency issue which happened at Konyak, Mr. Speaker, lives was not lost during the fire incidences. And some of the issues is because of the terrains and the rains, Mr. Speaker. So we cannot access in case of any emergencies, Mr. Speaker. So we need the department, Mr. Speaker, to come up with the regulation, preparedness, and policies on how to cap issues to do with emergencies. Another big incident, Mr. Speaker, is the emergency incidents which happened at Londiani, Mr. Speaker. The issue of accidents, which was an emergency, Mr. Speaker. We reached where we reached last time in the issue on the push and pull, or the issue of Londiani victims, Mr. Speaker. Because one, although we have emergency act, Mr. Speaker, we don't have a policy to operationalize the act. That is why we were caught in a quagmire on the usage of emergency funds in case of any emergency. So I think these prayers by Honorable Eric P., Mr. Speaker, is timely so that the department, the county executive, Mr. Speaker, can come up with policies on how to handle emergency issues related to El Nino and any other unforeseen emergencies. So I second this motion and urge Honorable House to consider these prayers. Otherwise, I second.
Thank you, the Honorable Esron Ngetich, for seconding the motion. And now, honorable members, I propose the question that the executive formulates policies on disaster management within 3 weeks and submits the same to the county assembly for approval. 2, that the county executive formulates risk assessment framework relating to El Nino within 2 weeks and forward the same to the county assembly. 3, the county executive comes up with detailed possible disaster preparedness plans that the county has in mitigating the unforeseen impact of the El Nino. And 4, the county to initiate partnerships with humanitarian organizations, multinational corporations operating within and outside the county, and other citizens of goodwill who are willing to assist the county in mitigating the unforeseen impact of the El Nino in Kericho County. Honorable members, the floor is now open for debate, and I will give to the Honorable Deputy Speaker.
Thank you, Mr. Speaker, for giving me this chance to contribute on the motion beforehand. And before I do that, Mr. Speaker, sir, I want to take this chance to also welcome learners from St. Patrick's Primary School who have joined us today. We are much welcome to this County Assembly of Kericho. As you look forward from the public gallery, just know that the difference between you and I is time, the clock. One day, if you work hard, you will sit as one of us here as members of the County Assembly or the Speaker. So work hard in school, all the best as you come to learn. Mr. Speaker, sir, I want to say a big thank you to Honorable Eric B. for bringing a very important motion this afternoon. Mr. Speaker, sir, this is one way of being proactive as members who are been elected in the role of representation. For Honorable Eric B. to have thought of such a motion is brilliant and very timely. I want to say this is very important because we are given the mandate of representation, and we cannot assume that the county executive is thinking about El Nino. So we have to prop them, and this is one way of doing it. So I support this motion, Mr. Speaker, sir, because as has been said in the motion, the experts have told us there will be El Nino. So the experts have given us warning. They have told us even to harvest our produce early. In fact, Mr. Speaker, sir, I am one farmer who has been able to organize my household and put my things in store earlier on. So secondly, Mr. Speaker, sir, so for the department of in charge of disaster management should be well prepared for such eventualities. And so it is very important that at this time, such a motion will actually compel them to work and to find ways of mitigating this foreseen challenge that is likely to come because of El Nino. Mr. Speaker, sir, I want to give an example of just why I support this motion is that about 2 years ago, or 1 year ago, the Honorable Emeritus Majority Leader, who was then Majority Leader at that time, was affected by a mudslide or landslide in his area. And I remember that time, Mr. Speaker, sir, that he was trying to do her fundraising with members to help some of his constituents who had been affected by a mudslide in those parts of Chilchila Ward and Kamashan Ward. And we were ill-equipped. There was nothing the county could do at that time because of a mudslide. There were families which lost crops. And the same experts have told us again that this year again, there's likely to be such kind of a thing. So my question I'm asking myself today is that, is the department prepared even for a mudslide? Is the department prepared even for just even children not going to school? Because disaster, even for kids not to go to school, is another disaster. So I think this motion is very timely. We need all of us to support because it's going to give the executive the time to reflect and to plan for the eventualities that will come. Mr. Speaker, sir, this motion is also very timely because it has mentioned about other agencies like the Kenya Red Cross. So the question is, even the executive, have they talked with these humanitarian organizations because they are available? I saw last week in those sides of Kunya going with support, and so it is very important that at this time that there are plans to work with Kenya Red Cross and other agencies to ensure that there are plans. These are also experts in humanitarian aids. So this motion, in my own view, is very important, and I think all of us need to support because it's going to give us time to reflect. The good thing about this motion, again, it has a timeline. which the Committee on Implementation will then be able to follow up. And I have full faith in my able chairman, Dr. Naaman Rob, that they will faithfully follow up on this motion, because we need to ensure that once it is passed, that it is action, because the time given is very timely. So, Mr. Speaker, sir, I want to fully support this motion and ask my colleagues also to support this particular motion, because it is very important at this time when we have a warning from the experts. Thank you, Mr. Speaker.
All right, thank you so much, the Honorable Deputy Speaker, Honorable Eric Pate, Honorable Anita Biagon, and then I'll give to Honorable Irene.
Thank you, Mr. Speaker, sir, for this opportunity to also contribute to this timely motion about the El Nino and the preparedness, which targets the disaster management team, which we will all agree, Mr. Speaker, sir, that we've never been prepared. We've had cases over time that every time they happen, they find us not ready. But I want to appreciate Honorable Eric for actually thinking about this at this point in time, which I'm curious to see the response that comes from the respective department or the sector responding to this, because looking at the history and what has happened before, like in Chilchila, I'm concerned, because if we already have those the data from the meteorological department about the El Nino and all that, I'm thinking by now, Mr. Speaker, sir, we should even be thinking of or talking about already some of the people who are living in those bad terrains having been moved, because we cannot wait for a disaster to happen. Then we start talking of moving people to the safe spaces or the safe places. So, we have given them 3 weeks that we will pray, Mr. Speaker, sir, that we don't get a lot of rains and floods within the time we are waiting for this response. Otherwise, Mr. Speaker, sir, this should have been an immediate action, especially in the areas that we've seen we've seen the disasters happening. Otherwise, I want to fully support this, and also looking at the support when it comes to the financial, because most of these issues will also come in line, Mr. Speaker, sir, with the support system in terms of the financials. So I think it's also high time that as we work on our budget, that we make sure that the department is also supported in terms of giving them enough to be able to work around what they need to do. Mr. Speaker, sir, when we talk of disaster management, it reminds me of some of the cases that I've handled within my ward of people drowning, and every time you have such an emergency, you don't even get someone employed within the county government who comes to rescue. So it's been moments of, challenges that the department actually is facing, which I think what we are doing today should, enable them to be more proactive and like being on the receiving end until a disaster happens for them to move. Mr. Speaker, sir, I want to fully support this and make sure that I think we will be very keen to see the responses, and actually not just a response on paper, but actions happening in the few weeks, so that we are prepared for any eventualities when it comes to the floods and even the cases of diseases that might also come along with the flooding and all that. So we want to see all the departments working together. The health department, to make sure that they're also going to those areas and seeing what could happen and making sure that people are treated. If it's cases of malaria, what are some of the things that people should be aware of in the areas that could expect or anticipate they could be flooded? So thank you, Mr. Speaker, sir, and I support this fully. Thank you.
Thank you, the Honorable Anita. I give to Honorable Irene, and then I'll give to the Honorable Gilbert Ngatich.
So thank you, Mr. Speaker, for giving me this chance. Let me first take this opportunity to welcome students from St. Patrick's Primary, just the neighborhood. On behalf of your MCA is away on some duty, that is at Brook. So that is the message from the area MCA, Mheshimiwa Honorable Martin Cheruiyot. Let me take this time too to thank the mover of this motion, that is Honorable Eric B. He is a specialist in the field of medicine or health, and I know he is mindful of the people of this county, given that we have this this issue of El Nino. I happen also to be a teacher of geography, and I understand what entails climate change. This issue of El Nino, even the meteorological department might not establish the magnitude due to the effects of climate change. And this motion is timely. It is very timely indeed, given the consequences of this El Nino, ranging from diseases up to even our farms. So there could be very adverse effects after these rains. And even before, as we speak right now, people down the villages, there are a lot of diseases. People have malaria, people have different sorts of ailment. And I think if statistics of the number of people visiting our health centers is taken, then it is on the rise. People have begun to be sick, and we have to be prepared as a county. We have also in the field of agriculture, we need to be prepared. As Honorable Anita mentioned, measures need to be taken as early as today, because some people will require evacuation from their places of residence, because there could be floods, there could be mudslides or rockfall in regions that have been mentioned, like the cases where people live next to cliffs or mountains. So it is evident that rocks can fall because the soil is not compact anymore. So we are urging all the relevant departments to work towards preparation, this preparation, being disaster preparedness. A county that is not disaster prepared will always find its people suffering in the long run. So thank you, Honorable Eric B, for this wonderful motion. Thank you.
All right, thank you, the Honorable Irene. The Honorable Gilbert Ngatich, Honorable members, let us stick to our standing orders. If you start the debate with one language, if it's English, you complete with English. If it's Kiswahili, you complete with Kiswahili. All right.
Okay, thank you, Mr. Speaker, sir, for giving me this opportunity. It's like you've given people of Kishara Ward an opportunity to also support a motion. And before then, I want to welcome the students or pupils from, is it Riverside? St. Patrick's School. Welcome to the assembly, in which you will learn some parliamentary issues Now, thank you, Mr. Speaker, sir. I've also come up to support this particular motion, which was actually tabled by Honorable Eric B. In preparedness on this particular immunity, which of course we appreciate, because out of the envisage existing in the water stations, we will have a prolonged rain, which in the long run we will have a lot of rains, and eventually our rivers will expand. Mr. Speaker, sir, I want to support and fully support Mr. Speaker, sir, because I know in our areas we have got this situation which can emanate out of the rainy situation. We can have diseases, we can have also people drowning, we can also have roads also getting dilapidated because of the heavy rains. And in this preparedness, Mr. Speaker, sir, I would actually think that we will recommend that in people like us who are living next to big rivers like River Chemosi, in preparedness, we want to have them train some divers to be in standby, whereby whenever some people drowns, they can be able to actually save those lives or even retrieve the bodies for those who might have actually stayed for long in water. And this one I know cannot be done in a short run, but if they can actually do it for future, we will actually have a situation whereby we will never have people disappearing to the waters, could be for a very long time. Whenever such situations comes, our people do serve, they stay in the rivers all day out and even the night. Mr. Speaker, sir, so training for these divers, when this motion will actually be forwarded to the other side of the county government, we will have a recommendation on the same. And mainly, have people again to recommend on having some people to have make some drainage throughout the county, that is in the roads maintenance. We should be having team now working on the drainages in our county, so that we have our roads not so pathetic after these rains, Mr. Speaker, sir. Otherwise, this preparedness is really here on time, and I'm very sure that we will have to cap some problems which can arise from higher rains. An area called Kapchenach in Kishara Ward, although it is not near to any river, it actually have waters that emanates from the ground at the rainy season. And even the toilets do have some overflows, and eventually will have diseases like cholera out of such situations. So this preparedness, Honorable Chairman Health, will actually assist in the long run. My only request is that when this particular motion will be passed and a recommendation to be made with the other side of the executive, Honorable Chair Health, I request that you incorporate the divers and also the drainage maintaining during these times of rain. Thank you, Mr. Speaker, sir, for this opportunity.
All right, thank you so much, the Honorable Gilbert Ngetich. The Honorable Monica Pikwai. And then I've seen the hand of the Honorable Fancy, the Honorable Chief Whip.
Thank you once more, Honorable Speaker, for giving me an opportunity to also say something concerning this motion on the preparedness regarding the El Nino rains, which we are expecting in the next maybe 3 weeks. Honorable Speaker, this motion is very timely. I come from a place where we have children who come through bridges to access education. And since I come from that area, they have been asking me, what plans do you have concerning the bridges around that area? Because right now, they are only using two, I think you understand. Yeah, those, sorry? Yeah.
They're using footbridges.
Footbridges.
Yeah.
So I'm requesting the executive to look into the matter, because through such rivers we have lost lives, we have lost properties, because at times people use donkeys to carry their luggages, the farm output, and people have been losing properties, they have been losing lives. And it is my prayer that the executive or whoever concerned should do something on the same issue. Also, regarding diseases, we have been losing people through tetanus ailment. We have donkeys, and it is not in bad faith that I do mention such. Along our roads, we have donkeys, several of them. And when there is much rain, you can imagine how those droppings will be going to our rivers, and our people are using the same rivers to cross over, others even still bathing using the rivers. So I don't know if there are plans from the Department of Agriculture over the same issue. Otherwise, I want to say I fully support this motion and urge our people that they should be very prepared. As the government prepares, so people should also get prepared concerning El Nino. Thank you so much, Honorable Speaker.
Thank you, the Honorable Monica Kikwai, the Honorable Deputy Majority, Fancy Korir.
Okay, thank you, Mr. Speaker, sir, for giving me this chance. And I rise to support the motion given by Honorable Eric B., that for sure we need to have the disaster management policy. I also come from Finlays, and the way they've done their disaster preparedness is very high. So I urge the Kericho County government to come and benchmark from us, because for sure they've done the trainings on firefighters, the divers, and the people who can help in where there is mudslide and landslide. So they are really prepared. So I urge us that we come and learn from them. And again, disaster management is policy is something which we should be having like yesterday. The disasters have been happening in this Kericho County, and it happens that we are found not prepared. And God forbid, suppose an accident happens in this Kericho County again, we'll be found the same way we were, just like the other time. And now the floods, suppose it happens now or today, what will happen? We'll not have anything. So we should be having the fire engines, the people who have been trained, the divers, and maybe the flying doctors, because suppose today that flood comes, what are we going to do? Do we have all these things? We do not have. So I support this disaster management policy, so that the county government will come in handy and work with us and implement on the same. The risk assessment team should be giving us a report on the same, because for sure, Honorable Member from Chilchila have told us, and we should be having that risk assessment report from the executive, that they should be evacuating people from Chilchila to a safe place, so that it will not happen to our people. Otherwise, thank you so much.
Okay, thank you, the Honorable Fancy. The Honorable Chief Whip, your hand was up.
Thank you very much, Mr. Speaker. Mr. Speaker, I want to join my colleagues in welcoming pupils from Patrick Primary that is in Kapkugerwet ward. Number two, Mr. Speaker, I want to also give my input in appreciating the work that has been, the motion that has been brought to this floor by Honorable Eric B. Mr. Speaker, as has been adversely mentioned, that failure to plan is planning to fail. So I want to join in my colleagues in actually mentioning that disaster preparedness is actually very key. That is, Mr. Speaker, as recently witnessed in the previous years, that mudslides had actually rocked some parts of our county. And therefore, in my case, Mr. Speaker, I want to also request, as been indicated by Honorable Eric B., that multi-sectoral committee probably be formed by the executive, just like what the governor of Nairobi did the other day. So probably, in my case, PSM that is mandated for probably handling issues about emergencies, health department that is handling issues of health together with outbreaks of diseases, agriculture department that is to advise our farmers probably if some of the crops can actually be harvested, education that we all know in case of heavy rains, Mr. Speaker, most of the classrooms or even toilets at times can even sink. And lastly, issues about roads that is in our various places that are very dangerous. Mr. Speaker, in my ward, for example, on the issue of these food bridges, I want to confirm that most of the children that resides in a place called Chepkoslin usually crosses a bigger river towards a school known as Jamji. I also want to request that the department that is of roads, Mr. Speaker, if in case there are some of the areas that actually water can sweep the existing food bridges, we request that they can also consider probably using funds that are meant for under emergency. And that is actually the Department of Finance. So with all those, Mr. Speaker, I also want to join in my fellow colleagues that in the previous years we've witnessed mudslides adversely in Chiljila and the areas of Kunyak. And I remember we even took some blankets or mattresses the other time, Mr. Speaker. So I think this multi-sector committee, in my view, Mr. Speaker, departments should actually meet with immediate effect together with Red Cross, that is the Department of Finance, PSM, Health, Agriculture, Education, Roads, and probably non-governmental organization, so that they can plan in advance. Probably in 2 weeks' time, we should be ready with our guns loaded with the requisite funds. So with those few remarks, Mr. Speaker, I want to say we appreciate the work that the Honorable Member has done for the people of Kericho. Thank you very much.
All right, thank you so much, the Honorable Chief Whip, that is Harold Rotich, representing Cheptoro Yet Seretut Ward. The Honorable Edna Tanui.
Thank you, Mr. Speaker, for giving me this opportunity this afternoon, maybe to stand and support the motion that is in front of us. And first, before I continue, may I take this short opportunity to thank our pupils and learners from St. Patrick, Kapkugerwet Ward, for making their visit to be in this assembly today. Thank you for coming, and I wish you all the best in your journey of learning. Mr. Speaker, sir, I stand to support this motion, mainly because of some few reasons that we have seen or have come to witness in our areas. Disaster management is something that is affecting our people and farmers in our areas. Many farmers so far have a lot of fear when they are trying to plant their plantations, crops at this moment, many of them have fear that they will not do the usual plantation because of heavy rains. Secondly, we normally know that a lot of water come up with diseases. Waterborne diseases will rise to our people, and pneumonia will also be a big disease in our areas. We also know, Mr. Speaker, that our roads will be damaged in our areas, and a lot of mud in places, and no transport or no transport will be easy movement, will not be easy movement. So in our bridges, Mr. Speaker, sir, water will cross over our bridges and will create a lot of danger to our young children, and maybe many people will get drowned. And in that matter, Mr. Speaker, sir, I stand to support this motion, and maybe it should be effected immediately and as soon as now. Thank you very much, Mr. Speaker.
All right, thank you so much, the Honorable Edna Tanui. Now at this point in time, I want to give to the mover of the motion, the Honorable Eric B. to reply.
Thank you, Honorable Speaker, for giving me an opportunity just to reply. First of all, I'd like to thank honorable members for positively discussing on this motion, Mr. Speaker. I think this is a motion which is very weighty, and it has actually come on time. It is very timely, and what we only need after this approval, the department or the implementation committee to follow it up, so that we should not cut on time, Mr. Speaker. So thank you, honorable members. You've actually contributed much. And also thank you, Honorable Speaker, for allowing me also to come out with this debate on this day. Otherwise, thank you. Let's approve this report. Thank you.
All right. Thank you, the Honorable Eric B. Honorable members, I now rise to put a question that in its role to oversight the county executive and represent the people of Kericho County, this Honorable House resolved that 1, the County Executive Committee formulates policies on disaster management within 3 weeks and submit the same to the County Assembly for approval. 2, the County Executive formulates risks assessment and framework relating to El Nino within 2 weeks and forward the same to the County Assembly. 3, the County Executive Committee comes up with detailed possible disaster preparedness plans that the county has in mitigating the unforeseen impact of the El Nino. And 4, the county to initiate partnerships with humanitarian organizations, multinational corporations operating within and outside the county, and any other citizens of goodwill who are willing to assist the county in mitigating the unforeseen impact of the El Nino in Kericho County. Will as many of similar opinions say aye? Will as many of contrary opinions say nay? And the ayes have it. Honorable members, there being no other order of business, this assembly stands adjourned until tomorrow morning, Wednesday, 27th September 2023 at 9:30 a.m.